Okay, well, good afternoon, everyone. I'd like to welcome you all to ABFE's Membership Mondays Member Spotlight. My name is Evelyn Rivera. I am the Director of Membership for ABFE, and this is a program that we've been doing since the end of last year, middle of last year. It allows us to introduce you, members and non-members, to our fellow members at ABFE. It also is an opportunity for us to engage a little bit with some questions and Q&A after the program. So I thank you all for taking some time to share this with us today. And today's Spotlight member guest is Health Forward, the Health Forward Foundation. And we are going to be speaking with Angie Williams, Director of Community Investment and Impact, and McClain Bryant Macklin, Director of Policy and Strategic Initiatives. And they're going to talk about their purpose alignment, as well as touch on the impact of philanthropy on mental health. And I want to just give a little background on both Angelique and McClain. Angelique joined Health Forward as a Director of Community Investment and Impact in 2021. She previously served as Regional Director of Development for the American Red Cross Greater Kansas City Chapter. Before her time at the American Red Cross, she was the Senior Vice President of Member Engagement and Inclusion at YMCA of Greater Kansas City. Angie has a bachelor's in sociology from the University of Colorado at Boulder. And McClain Bryant Macklin, Director of Policy and Strategic Initiatives, joined Health Forward in 2020 as the Director of Policy and Strategic Initiatives. She is responsible for establishing the strategy for Health Forward's policy priorities and executing a plan to fulfill those objectives through direct lobbying, grant making, strategic partnerships, and initiatives. Prior to joining Health Forward, McClain served as Director of Policy and Research for the Greater Kansas City Civic Council. McClain earned a bachelor's degree in business administration and a master of business administration from Florida A&M University. She also holds a law degree from the George Washington University Law School. So I'd like to welcome you ladies to our membership spotlight. Thank you for being a part of this. I know it was a little bit of a pull and tug to get us here, but I'm so glad you were able to make the time to get here. So I am now going to turn the program over to the two of you.
Thank you, Evelyn. Can you hear me okay?
Yes. Oh, and before you get started, I'd like to ask the audience if you can put any questions you have for McClain and Angie in the chat. We'll be fielding those after their presentation. Thank you. And please mute yourselves as well. Thank you. Okay, Angie.
Yes, thank you, Evelyn. And thank you for those of you who've chosen to spend this time with us today. We are encouraged to be here, encouraged to be new members of ABFE. And quite frankly, Evelyn, I don't know how much more I should say about myself. The intro was great. So I appreciate so much that you've given us the time to really introduce ourselves. I had my first opportunity, I believe McClain as well, to be present at the conference this year and had an incredible time getting to know other members of ABFE. And just being able to collect what it felt like as a family reunion, quite frankly. So thrilled to be able to share this time and space with you. McClain, would you like to say anything?
Sure, I just echo Angie's sentiments. I had a great time at the ABFE conference this past spring as a new member and really look forward to attending more and getting to know more of the other members and finding opportunities to be thought partners with one another and work together into the future.
Sounds good. Well, we will spend some time with you today. We won't get too in-depth, stay probably more high level, providing more opportunity for questions and really dialogue and conversation today with you. I did notice that there are several Health Forward teammates on the line as well with us. So looking forward to really having more of a discussion, allowing McClain and I to touch on a few things, but certainly want to welcome and thank our team for joining and invite them to join into the conversation as experts in some of the areas that we will speak to today. So we can certainly advance to slide 2. Over the past 2.5 years or so, our team has been on an adaptive journey to create and align a purpose plan or strategic plan that moves the needle over the next 10 years in health equity. We have sat at the feet of many to learn more about how our communities of focus have experienced the health ecosystem. And through that process, we've created a purpose alignment plan we feel begins to take a confident approach at seeing some movement. We know that Black and Brown and rural communities suffer the greatest disparities, which lead to a compelling reflection, excuse me, my voice today, suffering the greatest disparities, which led to a compelling reflection and shift in how we began to map our work in supporting community needs. Our vision as an organization hasn't changed, neither has our mission, but we have catalyzed a purpose-directed catalyzed our purpose in the direction that we seek moving forward. We can shift to the next slide. So given our purpose, which communities are we focused on? Our communities of focus within the Health Forward's community is prioritizing people who experience the greatest injustices in health outcomes, which includes people of color whose outcomes are shaped by structural racism and other socioeconomic conditions, and people in rural areas where systematic barriers hinder optimal health. We know that these communities often overlap with people of varied identities who are experiencing economic insecurity and live in marginalized conditions and have been systematically barred from accessing high quality care that is affordable but equitable, but more importantly, even trauma informed. We can shift to slide 4. The Health Forward Foundation has had a history in Kansas City, Missouri of providing support, thought partnership, and building relationships for over 17 years with the focus of strengthening the ecosystem for all. There have been many factors that have influenced our thought process and our targeted approach. From the social injustices that have been occurring in this country to people of color for a multitude of years, heightened by the George Floyd murder, the COVID-19 pandemic, the housing crisis, we have strategized in how we filter our decisions. We recognize that it is at this nexus, race equity and economic inclusion, health equity lives and can be obtained. Slide 5. I won't spend a lot of time here, but this slide points at the statistics and evidence that some need to see beyond the lived experience our communities share with us for years, recognizes racism is the driving force of social influences of health, pointing to the life expectancy of people of color oftentimes being a decade shorter than that of their white neighbors. Also pointing at the systemic exclusion of Black and Brown households from income and wealth generation, when there is significant research that shows increases in income and wealth generally correspond with improvements in health. Slide 6. You've probably seen a slide like this before, but there's a lot of great work occurring at what we might call the people fixing levels. But the evidence is clear that people aren't the problem. Their conditions are the problem. And together, we've done really good rewarding work in supporting direct services and needs at the downstream and midstream levels. But at some point, we have to ask ourselves, do we want to keep mopping the floor, or can we together shut off the faucet? So at the Health Forward Foundation, we're excited to begin to rebalance our work. Not only rebalancing our work, but our leadership, our advocacy, our resources to amplify systems change conditions, shaping the work, and centering racial and economic equity. While the data suggests it's a no-brainer, it remains emotionally complex and intellectually challenging for many, particularly since changing conditions requires us to grapple with the tension between equality and equity, especially when it comes to racial equity. We can shift to slide 7. So the next slide, which is probably very, very tough for you to be able to see, but it represents our initial attempt to capture our priority focus areas and aligns our 5-year purpose plan in a strategic manner. So over the next 3 hours, we're going to break you up into groups and dissect each of these areas. Everybody ready? No, I'm really just kidding. Evelyn said we had an hour. We do not plan to keep you.
You can't see my face behind it, Angie. I was like, what?
I expected that to happen, and your eyes went big, and a million others did as well.
Oh, good. I love the humor.
But there is a lot here. I guess that's what I want to really express. There's a lot here on this slide that we call our placemat, and it's kind of that guiding opportunity for us to be able to channel our focus. It speaks to the purpose, which you saw earlier, shares a little bit about our intended impact and some of the outcomes that we expect to see. But I want to focus a little bit on the different areas that we call our 4 purpose areas. McClain and I are more than happy to, after this, if there would like to be any one-on-one individual conversations or meetings that you'd like to have. We're sure that these slides will probably be shared as well, and that's fine too. We also have it on our website. So know that there are a variety of different ways that we can continue to have dialogue and conversation to really dive into this. But today, we will just be happy to spend a little bit of time in thought partnership with you around a high-level overview of these areas, and hoping to illuminate some examples that give you a sense of the work that we're doing in each of the spaces. So in the gray circle, we have what we call our overarching and cross-cutting platform focus. In this space is our effort to catalyze action around racial equity, economic inclusion, and health equity. And so an example of this work is an initiative we are undergoing called Be Great. Be Great is focused on utilizing lived experience and community members as experts in sharing their stories in a video documentary. It is designed to leverage narratives for learning and as a tool to mobilize communities of color to address health inequities and upstream barriers. McClain and I will work together on this slide to kind of elevate some of the work that we're doing. So McClain will speak to and illuminate place for us.
Sure. And Angie and I are sort of tag teaming this because there are a couple of the areas that I'm leading, and then there are a couple that she's either leading or more involved in, vice versa. So with regard to place, our place focus area is where we have really tried to hone in on the social drivers of health. You might have heard them referred to as the social determinants of health or the social influencers of health, but we call them either influencers or drivers because they are not determinant, but they do have a strong influence on our health. So we think about things like, childcare, access to transportation, access to the whole host of things that lend to our quality of life. Given there is a seemingly infinite universe of those social drivers, we've had to focus in on the 2 that we feel like are most pressing within our community, as well as those that have an outweighed influence on our health and where we are uniquely situated to provide some support, even because of our subject matter expertise or because there's just an absence of support focused on these areas in our communities. So we focused on equitable digital access and literacy, as these things and digital equity has been recently dubbed as the super social driver of health. And then we've also focused on creating pathways to afford affordable, quality, safe home ownership, as home ownership and property ownership has been the primary means of amassing wealth in this country, and wealth is in many instances an equalizer. This is our newest focus area for us organizationally, in that it's the area where we have the least amount of organizational experience. And so we're taking the year to learn the landscape to assess how we might put our dollars to good community use in both of these areas of digital access and home ownership. And then I'll turn it back over to Angie to go over people.
Absolutely. So in people, and the strategies there that we are highly focused on are really strengthening the capacity and effectiveness of partners and providing what we call whole person care, and that it's equity centered in its care. And so with the focus of advancing equity centered whole person care, we have engaged and are piloting what we're calling the Kansas City Health Equity Learning and Action Network, which convenes our region's healthcare ecosystem, our key stakeholders, as well as community-based organizations to collectively address the factors that contribute to inequities in health access, treatment, and in outcomes. This is an area where we see ourselves championing an inclusive and culturally responsive health sciences workforce, as well as advocating for policies that improve health and health outcomes. McClain, would you like to go over power?
Yep. So our fourth purpose area we're calling power. And this is the area where we're focusing on capacity building for BIPOC-led grassroots organizations and increasing civic participation and democracy and supporting community-driven efforts to redistribute and share power. We often hear the communities that we serve referred to as though, you know, there is some deficit, when really the only deficit is that these communities have been starved of the resources necessary to act or advocate on their own behalves. And so we are focusing our work in this area to share and build power within the communities that we serve, hoping to work and grant, make, and advocate ourselves out of a job one day. So we're doing some really cool stuff in this area. For instance, working with Brasilia, who I know ABFE is very familiar with, but that we've only become familiar with in this last year, and feel ourselves fortunate to have developed this relationship, which is being deployed to provide some capacity building to our Black and Latino-led grassroots grantees to help to shore them up and better enable them to do more of the great work that they're already doing. We're also seeing the launch of a statewide voter registration initiative focused on Black, Latino, and Asian populations, while those populations continue to grow, demographically in proportion to, the makeup of our country. The voter registration numbers are lagging. And so we're investing some funds in the Kansas City and St. Louis areas to start to register those voters. Next slide, please. So I know that many of you don't know us, so I'm going to take a second just to provide some more context on just who we are. Health Forward is the product of the sale of a nonprofit hospital to a for-profit hospital. Health has always been our focus, and really to drill down on that, to be more distilled, we're really focused on ensuring that individuals who make low incomes have access to safe, quality, and affordable health care. We operate in 6 counties spanning 2 states, Kansas and Missouri, including urban areas, suburban areas, and rural areas, just for that added context as we explain more about the work that we do. We have a Black female board chair, a Black female HBCU graduate CEO, and a diverse leadership team of women, Black and Latino leaders. And we consider ourselves somewhat of a unicorn because of all of this. And we are very much leaning to it and using our lived experiences to inform the work that we're doing. We talked a lot up to this point about our new purpose plan and our why. And we jumped right in because we're, quite frankly, very excited about the work that we're doing and the way that we're doing it, and the why that we're doing it. But it hasn't always been this way. Given this is Mental Health Month, We'd like to use our mental health giving as a case study of sorts for our new approaches. So bear with me as I try to connect sort of the health forward of old to the health forward of new, and demonstrating sort of the why we have made this transition. So mental health has always been a focal point of ours, now incorporated into the people area that Angie gave an overview of, but has historically been a standalone foundation-defined grant area for which we did RFPs on an annual basis to meet community mental health needs. But both the pandemic and recent social illumination, and I say illumination because light was merely shown on existing issues, required us and empowered us to do what many of us knew we should have been doing, but for one reason or another, the will wasn't there. COVID necessitated we immediately employ methods of trust-based philanthropy, which we had dabbled in a bit, but had not incorporated on a large scale to get dollars out of the door post-haste to meet needs. And need was particularly great in the area of mental health. These next several slides will take you through what we did in response to the COVID-related mental health crisis, which happened to provide the test cases we needed to move all of our grant making in the direction of less paperwork, less bureaucracy, and more responsive community needs. This slide in particular describes our advocacy work related to COVID-19. We used our voices locally and across the state to advocate for COVID resources and to raise awareness. And this is worth noting because COVID-19 and related advocacy was not a part of our board adopted policy agenda, but we adapted as was necessary to meet arising needs. Next slide, please. Thank you. This slide describes how we pivoted in our grant making, again, allowing ourselves to be adaptive and take new approaches or to go even further into the realm of trust-based philanthropy than we had been before. And I'll read just some examples of what we did and description of what we did along the right side. So active grantees received a total of $6 million in advance payments from us. We converted all of our active grants to general operating support to allow our grantees the flexibility that they needed to pivot in response to the pandemic and not be held to the constraints that were within the grant as it was initially conceptualized. We eliminated all interim reporting for active grants and extended final report deadlines. We pre-approved a 6-month grant extension for all grants, again, to provide increased flexibility to them, knowing that they were all under the water, trying to meet needs that they just could not have anticipated. And we reevaluated and shifted application processes and awards for our applicant-defined grants, our healthy community grants, which is one of our other focal points. We had 3 healthy communities grants and mental health grants being 2 of them. Regarding that last bullet in particular, our responsive grant processes allowed our mental health program officers to identify and recommend proposals from our applicant-defined grant applications. We call them ADGs. And so we had a more, I hesitate to say formal because it's all kind of formal, but we had a foundation-defined process. We put out RFPs in 3 distinct categories where we were a bit more limited in what we accepted as responsive to those requests for proposals. And then we also had an applicant-defined process, which was intended to be more responsive and sort of reactionary to the applications that we received from potential grantees that are closer to the work and somewhat closer in time to what the needs of the community were at that particular time. So instead of having to wait until the RFP application and approval process for our mental health round completed in August of 2020, as an example, proposals for organizations whose ADG requests focused on need for core operating support due to COVID impact or need to provide specific related services were approved for limited expedited funding, again, enabling ourselves to move more quickly to respond to the mounting needs of our grantees and the communities that we serve. Next slide, please. So not only did we adapt our existing ways of grant making, we created new ones. The reason being, we needed to ensure that our partners had the resources that they needed to vaccinate people and to help people deal with the monumental increases in pressures and stressors of COVID and the bombardment of stories all over the media and our phones related to the careless shootings of unarmed Black people. Next slide, please. This slide details more of how we stewarded dollars toward emergency funding to provide food, childcare, emotional and mental supports, testing, and contact tracing, all of which we know contributed to and continue to contribute to the physical and mental well-being of the people that we serve. And this slide and the prior slide just demonstrate how, the $1.8 million in new grant supports that we created, how those were allocated to meet, the whole host of needs that were exacerbated by COVID. This particular slide is where you see our concentration on mental health. We provided $400,000 of that $1.8 million in new grants to organizations that almost exclusively provide mental health services, in addition to the dollars that we granted on the previous slides, clinics and hospitals that also do this work. Our unrestricted dollars were used for core operating support for organizations experiencing just myriad needs, spanning from budget shortfalls and increases in demand for their services, like increased crisis service calls or demands on limited staff capacity. We saw a lot of increase in technology needs, increases in needs for medication and lab supports, but all for the benefit of kids, families, and seniors in our region. We also contributed $350,000 to a $6 million regional fund that was a collaborative of many of the foundations in the Kansas City area, both in Kansas and in Missouri. That fund focused on 4 things, behavioral health being one, in addition to digital equity, housing, and workforce and childcare related needs. As one of the 2 health foundations in this regional collaborative, though, we also contributed our thought leadership and relationships with the community to ensure that community voice and lived experiences were part of the decision-making process. And since I see Donna on here, I want to give her a shout out. She was one of our formerly known as program officers for our mental health focus area. And when I say we, some of this, I really mean her, provided the thought leadership and helped to ensure that behavioral health was supported in the way that it needed to be in this regional collaborative. Next slide, please. And this is us. This is Health Forward in a approximately 15-minute nutshell. We'd be happy to answer any questions that you have or welcome the opportunity to connect with you all in the future. And Angie, I don't know if you have anything to add because I know we've got time.
Well, it's interesting that you said that, McClain, because we were shooting for Evelyn a 15-minute presentation, and here we find ourselves at 11:30. So we would have gone over anyway with the time that you gave us. So our apologies in that. So
no need to apologize at all. That's what this is for. That's why we put in the extra time, because sometimes conversations can take their own life. So of course, it's totally fine. So no need to apologize. And this was very much a lot of information in a nutshell. Like, you guys are, to put all this in a presentation, 15 minutes, that's a whole lot of work y'all are doing. So bravo to Health Forward and you guys for putting this all together. And like I said, I encourage folks to put their questions in the chat. Terrell, I saw your question and I'll get to it in a second. I just crafted a couple of my own questions so I can sound like I'm smart and everything. So the first question is an article, I sort of pulled this from the internet, an article in the American Nonprofit Academy states that 1 in 5 American adults experience mental illness in any given year. 2 in 5 amid the pandemic, and the impacts of mental health issues extend far beyond the individual. My question is, how do you guys think, or how does Health Forward think philanthropy has impacted mental health pre-pandemic, and I don't want to say post-pandemic because we're still in the middle of it. So I guess pre-pandemic and then to where we are now. What differences are you guys seeing, and how has philanthropy impacted that? And that's for either one of you.
I think we both will probably have an opportunity to answer that in different ways. Mm-hmm. It's interesting, the question in regards to how has philanthropy impacted it. I kind of see it from the other way around, Evelyn. Mm-hmm. I feel like the pandemic has impacted philanthropy from the standpoint of it certainly has come and shared or shined a new light on how philanthropy might need to be done. As you mentioned, I've been with Health Forward for about a year now, just over a year. And so the team was already responding to COVID needs as I joined. Mm-hmm. And as I think on some of the stories that were shared, and I think McClain might have touched on some of this already as well, is that the way in which we were funding shifted dramatically. Philanthropy, and not just Health Forward, but within our community, what we saw was an immediate response of being able to grant, not so much focused on all of the burdensome reporting and the burdensome red tape of cutting checks and meeting need. We responded quickly because our community needed us to. And so I feel like the pandemic has really helped the philanthropic space learn more about the urgency that our communities are facing, and that we need to shift in the way in which our processes are set up, our approaches have been set up, and respond as in true urgency, because our communities, especially Black and Brown and rural communities, we're dealing with our own epidemics, right? So we need to respond in such a way daily in our systems within philanthropy. And so I feel like that is how COVID has impacted us. As it relates to mental health, what we see is that, and we're seeing it in schools, right? Mm-hmm. We're seeing it across the board in education, in our CBOs, we're seeing it CMOs, excuse me, we're seeing it all over. And we, from a foundation standpoint, as we were creating our budget last year, we recognized that we needed to budget far more in our mental health budget to be able to support some of what we were seeing as well. So I don't see that changing anytime soon. McClain, I'm curious to know what your thoughts might be on that. Donna, I won't call you out at all on that. She's like, thank you, God, please don't call me out. But I will say, if there's, she has truly been, her and another gentleman on our team, Shannon Morris, have really been our experts in this area. And so if there's anything that you feel would be great for, wonderful. She's put some things in the chat for this community to hear and see. The chat's a good place to, Donna. So I appreciate that. McClain, what might you add?
Sure. I'll add, and I'm 2 years into philanthropy, so still fairly new myself. But I did jump in at Health Forward right when we were beginning to make these pivots. And the sense that I have, and Donna can correct me in the chat or otherwise if I'm wrong, is that we have been unique, along with our, other partners, in other, health foundations. We were unique in the supports that we were offering to support behavioral health. Other sorts of philanthropy weren't really focused in that space. And that was really apparent when we joined our regional COVID Rapid Response and Recovery Fund, and those sorts of funds were popping up all over the nation to respond to the pandemic. No one other than the health foundations had any real experience or relationships or learnings to share on what the community health needs might be, or the organizations we needed to reach out to see how we could help them or what they were experiencing. So, felt fortunate that we were able to bring that to the conversation and lift that up. Learned a lot along the way, both from, the fund and the collaboration of the fund itself and how to approach philanthropy more, I think, collaboratively, but also the pandemic itself really shone the light on the behavioral and mental health needs of our mental health workforce, because that fund ended up putting a lot of money toward ensuring that our behavioral health workforce had the supports that they needed so that they could then be of service to others, which I don't think was something folks were focused on in the past. It's like, go to work, do your job. And now it's, how do we support you in your ability to do that? And like Angie said, it's kind of like we reached that crisis point. Things were bad, getting worse. And then we reached that crisis point, and now folks are ready to do what we should have been doing all along in terms of a nationwide focus on behavioral health. From an advocacy standpoint, we jumped right to it. And again, fortunate to have that experience to lean on, to be loud and proud in our advocacy around the need to disaggregate COVID data around, race, ethnicity, language, what have you, because we weren't getting the full picture of who was being impacted the most without that disaggregation. We used our voices to reach out to the governors of both states to say, we need resources, and if you need our help and how to think through deploying them, we're here. We use our advocacy around the establishment of the 988 hotline. Donna, I'm looking at Donna's stuff real close, because Donna has been my ally in all of this because she's gone so deep in mental health for so long. But we, I mentioned this in the slides, we are undergoing this whole learning exercise that spanned a couple of years now to be more adaptive in the way that we approach things. And our policy agenda has been one place that we have adopted these adaptive principles. Like, we had a policy agenda that was adopted by our board pre-pandemic. And then when the pandemic came, it was like, okay, yes, those needs are still there, but we need to incorporate some other stuff so that we can make sure we address the need that's now.
Yeah. And I appreciate that you brought up that the people who are in this, the behavioral health industry, helping others, like if their behavioral health is not at a level where they can help others, then it's not going to be any use to anyone. So I appreciate that you brought that up, because I do think people forget that. I think they forget that, the doctors and all those people who are in this field just kind of, do your job and that's it. And what about me? And what about them too? Like, they're people too. So I appreciate that you brought that up. So, and I don't know if Donna, I see she's trying to hide behind this statement here, but I'm happy to read it just so, because you guys have been calling her out, and I think it's something important just to mention.
Thank you. I am sorry. I have to be off camera today because I wasn't planning to be in meetings. So
that's okay.
Yes.
That's okay. Did you want to read your statement that you put in the chat just to kind of chime into what this was, this question?
Oh, no, I won't read it to you, but I agree with everything that Angie and McClain have described. Kansas City region and particularly our urban areas, we are in many ways blessed with the diversity of resources around behavioral health, and at the same time challenged. And I think post-COVID, the ability, particularly for communities of color, to collectively look at what's available, particularly when we saw the Great Resignation during COVID, and what was already shortages in clinicians of color and bilingual staff, as well as peer support. We have seen just a real kind of, I'd say in the past year, new energy around filling those gaps. Very grassroots, very authentic and organic. And so in addition to trying to have a place that ensures we are supporting equitable service in our large systems, our CCBHOs and FQHCs. We're also and have always supported a community of care in our schools, in churches, neighborhood associations, our recovery networks that are really right now I think in a period of growth. And so I'm optimistic in terms of what the next few years look like in regards to building stronger behavioral health systems.
Oh, that's good. Thank you, Donna. Thank you for sharing that. So I wanted to get to Tyrell's question. Tyrell Smith, he's from the Smith Family Foundation. And I don't know, Tyrell, since we're sort of a small group, do you want to just say your question?
Yeah, I'll say my question. My question was, like, do you guys focus on funding organization when it comes to maternal health as well? Because we know there's a great disparity when it comes to African-American women when it comes to maternal health. So do you guys also focus on funding organizations when it comes to maternal health?
Yeah.
Oh, go ahead, McClain. Go ahead, McClain.
No, and Angie's probably the best person to speak to this. Maternal health is very much a part of our people area. There are a lot of things that fall within that area. Anything directly associated with health is there. And from an advocacy standpoint, used our voice and relationship. And the way that we view our advocacy work is as an extension of the advocacy needs of our grantees, knowing that we're a much better resource than any of the organizations that we grant dollars to. We use our voice and our relationship and our dollars to advocate on, community interests and not really the interests of our organization, but they're really all the same. I mean, we exist to serve the community. So there's that. Did lobby and otherwise advocate for some equitizing legislation in Kansas around tracking Black maternal deaths and infant mortality in Kansas, so that we've got the data that we need to say, okay, this isn't right, and take that next step in advocacy, like do something about it. Made similar attempts in Missouri, but that legislation was not successful, but we'll continue to use our voice and our resources in that way, and are looking to be much more focused on maternal health outcomes for people of color in our grant making going forward. And I'll pause because I know, Angie, we recently joined like an association where that work will live.
Yes, absolutely. I won't belabor the point, but I think McClain is right on with the work that she's doing. And Tyrell, yes, absolutely has to be a focus of ours. One of the things we did not say in reference to our purpose plan is that there's quite a few intersections between all areas. None of them sit silently on their own, but work concurrently together in concert. So I would answer that we absolutely recognize the urgency and the importance of and issues related to maternal child health care and the long-term health benefit of birthing persons and children across the state of Missouri. And so, of course, our focus is within Kansas City. And so the organization that McClain was speaking to that we will begin to serve on is the Missouri Hospital Association. And so that is one piece to it, but we will continue to work within our community to support in this way as well, recognizing that Black and Brown women are suffering at this at a higher percentage than others.
Tyrell, did you have another question? I see you raised your hand.
Yeah, I did, but I'll let somebody else go before I go to my second question.
I think you can go ahead. I'm checking the chat. I don't see, unless anyone else has another question they want to verbally say, but you can go ahead, Tyrell.
I was just going to ask him to just to expand a little bit more in advanced digital access. Like, how does that correlate with health? And because I know during the pandemic, we had an issue down here when it came to adequate pairs of headphones and the digital divide down here in Trenton, with, you know, the kids having adequate, you know, pairs of headphones and laptops and stuff like that. I'm just trying to see how you guys are correlating and kind of putting it together.
Yeah. So across all sort of schools of thought now, it's been widely accepted that digital access is a social influencer of health. In the last couple of years, they started referring to it as the super social influencer of health because of the impact the digital access has on every facet of our lives. In this digital economy, you can't do anything without an internet connection, or at the very least, a smartphone with a huge unlimited data cap to where you can access videos and Zooms or your social networks. When we were, you know, socially distancing and unable to get together in person, to accessing telehealth and telemedicine virtually during the pandemic when we couldn't go into the doctor's office, to looking for housing on Zillow, to trying to, you know, go on Niche in Kansas City to figure out the best school options for educating your kids. Like, there's just nothing that you can do. And so with access to childcare, access to transportation and finding your bus route online, access to whatever, being dictated by your access to the internet.
Right.
That's why it's been dubbed the super. I guess we're most focused on the relationship between digital access and digital equity and telehealth equity. You know, given those two are inextricable, particularly in our rural areas where you can either drive, you know, 25 to 40 minutes to access a general practitioner, and there is no specialty care in your area. And so your best option is to do it virtually, but the infrastructure isn't in place, so you can't do a video visit. Understanding that we need to tackle both if we're going to attack either.
Yeah, I agree 100%, because we had that same issue down here in Trenton. Like, you know, okay, we're going to provide them with laptops or headphones, but now we got to look at the bandwidth of, you know, the internet. You know, we got like 4 or 5 kids in the house, and the mom is working off her cell phone. You know,
Right.
Yeah, and so it's a 3-pronged access. Oh, I'm sorry.
I agree with you 100% about how that's affecting.
Yeah, yeah, and it's very much like they call it the 3-legged stool. There's the affordability issue, like the infrastructure is there, but you can't either afford it amongst your whole competing universe of needs, keep the lights on, or, you know, buy broadband, or you can't afford a laptop or a computer, or you don't know how to use them. There was a time in this work when, and I was the policy director for our mayor for about 5 years before, you know, moving on. And so focused heavily on digital equity during my time at the city. And it, in my mind, was the most pressing emerging issue at the time, because I don't think folks like us, you know, we took it for granted. Oh, you know, we got the internet and we do all the things that the internet does, without thinking about the folks that didn't, and our seniors in particular, who were picking up, you know, a mouse and pointing it at the computer as though, you know, they could, you know, change the channel.
Right.
So there's just a lot of work that needs to be done in the communities that we're most focused on to ensure, you know, everybody's coming along in this 21st century economy.
Yeah. And I think it also too, McClain, thanks for eloquently speaking to that. I think the other side of it too, that we notice is that the plans that we have in this space, we recognize it's not a quick, easy fix. I mean, McClain's talking about full out infrastructure shifts and changes at the state and federal levels of some of the work that we have to do. And so as we started out speaking to a purposed plan, we recognize that while it's a 5-year plan, we understand also that some of this work is going to 10-year impact, or some of it, we may not even be here to see what the outcomes look like, right? So we are gearing up, not just in that space, but in other spaces where we recognize that it may not be support related to a check, right? It may be support in our advocacy, the way in which we support and help lift voices and power share within communities. It may be just leadership, just in leadership, resource, and advocacy. So it comes in three different forms in the way in which we see it, recognizing that many of the complexity of the work that we have in front of us will take some time.
So thank you, Tara, for your question. I actually have a little bit of a follow-up to that one. It's something I had written down before, because you mentioned your focus areas, as Terrell said, was around equitable and digital access and literacy, home ownership, property ownership. So how is Health Forward, because I'm sure these are so many areas, how is Health Forward building your knowledge in these areas in order to share this with the community or to pass this information on to the community? How are you educating yourselves with what the needs are and all that?
Yeah, and I think the sharing with the community is something that we definitely want to do and need to think more about. Making sort of our learnings public in some way. We have our heads down in a sense, making sure that we are well equipped to do this work. And so our learning and evaluations team has been charged with putting together a learning plan for the entirety of the organization. Place specific. We have been talking to the folks that we know are doing this work and asking them about the folks that we don't know that are doing this work that we should also talk to. We've gone national, to talk to the Urban Institute because they do a lot of work focused on affordable housing. We've gone, to meetings with the LISC. We've got somebody from LISC on our board to ask them. We've talked to our former, regional HUD administrator. We've talked to community developments, developers who are doing single family infill or rehabs in the urban core to figure out what their barriers are. We're talking to everybody because we are at a place where we're still trying to figure out how best we can show up and where our resources are really needed, whether that's, gap financing or whether that's credit counseling or what that might be. Our focus on housing really has to do with the fact, or home ownership has to do with the fact that, obviously that's an opportunity to build wealth and to generational wealth. But within that, we are also focused on the pathways to getting there, understanding that not everybody can just go out and buy a home. And so we've got to offer some supports along the way as well. But just being authentic and humble at the fact that there's a whole lot we need to learn while keeping ourselves open to opportunities that might come up along the way in our learning journey that need to be acted upon more immediately. We're also hiring a consultant who has gone deep in matters of housing, community development for years to help us sort of distill down what we've learned and put it into an actionable plan.
The only thing I would add to that, McClain, because I think she's spoken very well of what we're recognizing the fact that we don't know everything and that there's a lot to learn. There's also a lot to share. And so I would just add to that we're very much open to listening to the community and being guided by the community in that learning process. And then, of course, reporting back to that same community about where we are. And so it's important to make sure that we are surveying and that our feet are on the ground within our community for not just us teaching and sharing, but for us to be able to learn.
And we are one thing that we hadn't talked about, and again, Angie probably has more detail on this than me, so I'll just kind of tee you up, Angie. But we're looking at PRIs and MRIs and social impact investing in the housing space in particular, and really in all of our focus areas. But we see a lot of opportunity for purpose-related investments in housing. And so exactly how that will look, we don't know. But again, we know there's a lot of need on the capital side and the capital stack and how you make these affordable housing developments pencil out. And so we're exploring how we might deploy our capital in that way as well.
Okay. Well, this was an amazing discussion, ladies. I love that it kind of took on a little bit of a life on its own. I appreciate you guys' time. I thank you, Health Forward. I thank you, Angie. I thank you, McClain. And I thank everyone who took the time to spend some time with us, because you could have been anywhere else and you took the time to be here with us. So I so appreciate you all. Hopefully we can do this again soon. And I thank you. I thank you. Thank you. And I don't know if McClain and Angie, if you want to put your information in the chat, if people have other questions, you know, after this, how can they reach you?
Absolutely happy to do so.
Okay.
Awesome.
Oh, great. Well, thank you all again. I hope everyone enjoys the rest of their day and have a great week. And I thank you guys.
Thank you for having us.
Okay.
Bye, everyone.
Thank you.
Bye.
Bye-bye.